Hello, and welcome to Office Hours, where I answer your questions about weight and weight medication. I'm Dr. Meghan. I'm a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is important because I actually prescribe these medications all the time. I actually talk to patients about their weight. I've helped hundreds of patients lose weight, and I'm here to help you too. So if you're confused about your weight, and if you have questions about weight medications, and if you want medically based answers to your weight questions, you are in the right place. Today, we're doing office hours, and in January of 2025, I'm doing daily office hours every day on YouTube Shorts. So if you have a question, please leave it on this video, leave it on another video, and I would love to answer it. As a caveat, as always, I can't answer personal medical questions. So if your question does lean a little bit personal, I'm going to change it a little bit to make it more broadly educationally applicable. So let's get started. First question, this is somebody who is on a GLP-1 receptor agonist. Okay, it's been 5 days. They're on the lowest dose. They've started to feel really tired throughout the day. They get cramps in their stomach. They have some hot spells and that feeling when you don't sleep enough and dry eyes and overall yuck feeling. I'll see how it goes, but at this stage, I'm concerned about how the side effects will increase as the dosage increases. If it does, I won't order again. I'll just finish what I have. Okay. So this is a great comment that I wanted to address because whether you're on Saxenda or Wegovy or Zepbound, a lot of people have not a great intro to those medications, and a lot of times that first week or first couple of weeks can be very bumpy. So I just want to let people know if you've started it or you're thinking about starting it, but you're scared, what can happen to a lot of people is they do have a pretty unpleasant couple of weeks. But what can also happen, and what happens quite a lot in my experience in my clinic, treating many people on these medications, is that your body starts to get used to it. And a lot of times these symptoms go away. And if they don't go away, at least they get better, or you learn how to manage them. So usually for people who are having a rough first couple of weeks, I keep them on the same dose if it's a Saxenda, because you can escalate a lot more quickly on Saxenda. Or if they're on Wegovy or Zepbound, I'm going to keep them on the very low dose, maybe for 2 months, maybe for 3 months. But we're going to do a much slower titration, really just to let their body get used to it. And we're going to lower our expectations about weight loss at that point, because the weight loss is likely going to happen, but you have to take the medication in order for the medications to work. So we really want to make it tolerable first and then see what happens. So I can't promise people that the side effects won't get worse, but you won't know until you try. And for a lot of people, they just don't. That first initial part is the worst, and then it does get a little better, if not a lot better, with time. So if you have questions about this, or this sounds like you, definitely chat with your prescribing physician as well, but good luck to you. Next question, what type of weight loss trajectory do you like to see in your patients? For someone who responded well in the beginning, and then around the 3-month mark, a drastic slow, like down from 3 pounds per week to 3 pounds in a month, despite dosage increase. Okay, what a great question. I like to see, of course, the answer that everybody's probably sick of is that everybody is different, but that is true. But in general, I like to see, and I've said this before, it's like the stock market. You're going to have some months where the decline is lower. You're going to have some months where it's a little more, where you've hit a plateau. But when you zoom out, the overall trajectory should be moving in the right directions. It also depends on where, it depends on many different things, but it depends on where you are in the stage of progression. So if you are, if you're at the maximum dose and you've been on that for several months, like that might be a good sign. You're just losing like very, very small amounts of weight now. That's probably a sign that your body is reaching its new normal, that new plateau that you're going to be at. I also have patients that, they're in the middle of their dosing and they just hit a plateau, and for whatever reason, They just don't lose on that dose, and then you go to the next one and they do. And sometimes there's just no rhyme or reason to it. You don't have the expectation that it's going to be completely linear, like it's all going to be very smooth in one direction. No, it's bumpy. It's bumpy, and that's okay as long as it's getting you where you want to be. This is also a really good time to think about, are there any other things that have changed for that patient if I'm talking to them? Have they started or stopped a workout routine? Have they started or stopped a new way of eating? Have they seen another doctor and started a different medication that now could be interfering? So, in addition to how the medication might just be working in their body, there are other external factors that are often at play as well. So, you want to make sure you're not missing anything like that as well. So, essentially, there's no one size fits all trajectory. I just like to see that people are making progress, and if it's slower 1 month or faster than 1 month, but people are eating normally, they're not having a lot of significant side effects, they're not hating their life, but it's just kind of a little different on one dose versus the other, a little faster, a little slower. I'm okay with that. And in general, a good rule of thumb is if somebody hasn't lost 5% or more of their weight loss by the 12-week mark, despite normal titration, kind of the normal titration schedule, not because we slowed it down or not because we had to stop, but if somebody is on the regular titration schedule, it's been about 12 weeks and they haven't lost 5% or more of their total body weight, and there are no other external factors that I think are contributing, that's a time when I'll really think, I wonder if this is going to be the right fit for somebody. And as a caveat, as always, the people who are on the medications that fight more with these, with the GLP-1s, I don't hold those people to the same standards, to that same 12-week standards, because a lot of times what tends to happen is they need to go up to the highest dose in order to really see a significant effect. Next question. Here's a question, and I know this is all very individual. Of all the meds that people tend to stack with the GLP-1s, metformin, phentermine, Jardiance, bupropion, naltrexone, topiramate, etc., which ones in your experience tend to be a bit better tolerated by patients, and which ones are most likely a rough ride, shall we say? This is a great question. So, as in terms of somebody who's already on a GLP-1 and I'm talking to them and we're thinking that for whatever reason we want to add something to it, like their BMI is in a good place, but we want to add something because we think that it'd be better to keep getting it lower, and they've already reached their plateau on the GLP-1, and we feel pretty certain about that. And this, of course, goes without saying that we're doing lifestyle changes and all those as well. But I would say in general, the thing, I think phentermine and the GLP-1s tend to work really well together. I think phentermine doesn't, for the right person, in my experience, it doesn't seem to have a lot of side effects. People don't generally hate it the way they hate other medications. And so I think phentermine is always, and again, and I've made a lot of videos about like who's the right person for phentermine and who isn't. So you can definitely go check those out. But I think phentermine is usually a pretty good, for the right person, is very well tolerated with the GLP-1s. And then phentermine topiramate as well. I think between phentermine and topiramate, in my experience, tends to be probably a little less well tolerated. People tend to get a little drowsy on that, but also phentermine and topiramate mix very well together, and they are packaged together as Qsymia. So in general, I would say phentermine and or topiramate and a GLP-1, in my experience, tend to work very well for people. Bupropion, naltrexone, I think that works too. Of the bupropion and naltrexone, because I'm usually prescribing it, separately as opposed to Contrave, because a lot of insurance companies won't cover Contrave and it can be very expensive for people out of pocket. Naltrexone seems to be the one that gives people a little more trouble than the bupropion. And I think overall, I generally prescribe the phentermine topiramate combo with the GLP-1s more. Um, Also because I think a lot of people are a little hesitant about the bupropion because it's an antidepressant and maybe they've never been on anything for their mood before and they don't really want to try something like that. And so sometimes I think people have a little more hesitation about that. In my experience, I don't usually prescribe Jardiance. Jardiance is not one that I tend to stack with a GLP-1. But metformin, that's definitely a problem child. I will say, whether it's with a GLP-1 or not, I mean, and which is too bad because um, it can be so helpful in so many ways for people. But it really, I think whether people are on it on their own or with a GLP-1, that one tends to be rougher. And especially with the GLP-1, it tends to be rougher because the side effect profile is very similar. And a lot of times, what happens with metformin is people just have a lot of diarrhea. And so, if you are on a GLP-1, you already went through that when you were starting the GLP-1, and now we're adding metformin. Sometimes, and I think overall, in my experience, GLP-1s tend to be better tolerated in general than metformin. I have a lot of people who just, maybe they have pre-diabetes and we've elected to start metformin, or they have diabetes and that's the first thing that they tried. And of course, you can play around with metformin too. The extended release is in general better tolerated than the regular immediate release, but overall, that is probably the most problematic combination. But I definitely have people who are on both of them. Some people are just very pharmaceutically robust and they don't have, like, they can take a lot of different things and it doesn't bother them. So I do have a lot of patients who are on both of those and they do just fine. But if I had to worry about one combination the most, that's the one I would worry about. But what a great question. Thank you so much. Calorie counting apps help a tremendous amount to keep on track. Yes, it's a burden, but for people who've overeaten their whole life, there may be difficulty, especially in the beginning, to be in a calorie counting deficit and get adequate protein. Yes, this comment I think is in response to a previous office hours where I touched on calorie counting and I said, some people love it, and for those people, do it, definitely, but it's not really something that I insist upon or that I even like for people because I really prefer, especially on these medications, especially because they really are strengthening that inner signal from your stomach to your brain, which is part of how the GLP-1s work, especially because they're strengthening that that natural signal. That I really like to shift people as much as possible to listening to their own body. I think it's easiest. It's the most portable. People like it the most. But I definitely hear what this person is saying because everybody who's starting a GLP-1 is coming to it from a different place. And there are some people who, maybe they never learned how to eat healthy. And that started from childhood. And what's normal for them has been a lot of takeout or processed food, or they just never really knew, like, people told them eat healthy, but they really didn't know what that was, or the concept of caloric density, or what happens with processed foods, which is that you can have so many calories packed into a small amount of food, but because it's so processed, your body doesn't recognize, and it has so much sugar usually, your body doesn't recognize it in the same way that it would a different, an unprocessed type of food. So in general, we need fat, we need fiber, we need protein to really send a signal to our stomach that we've eaten food, that we're full. Those are really good signals to tell our body that we've had enough. And a lot of times with processed food, there's a lot of sugar, but there's not really fiber. There's not usually protein. Sometimes there's fat, sometimes there's not, but it really hijacks our natural digestive system that has evolved to tell us when our meal is done. So people can eat a lot more of that and still be hungry later because their body doesn't realize the amount of calories that they've taken in. So I definitely think there's a time and a place for people. I think if you are somebody who is really starting off with a very, this is all brand new to you, then that could be a very helpful tool. Seeing a nutritionist or dietitian could be a very helpful tool. Like, use whatever resources help you. What I don't love is if it starts to feel like a burden, or if people get really like tied down into the minutia of it, like, or it's causing a lot of mental angst, like it's more food noise rather than less food noise. That's where I have a problem with the calorie counting apps. But a lot of this is, of course, trying things and seeing what works for them, and also giving them enough time to work as well. So a lot of times people will try things for a very, very, very short amount of time, be like, I tried it, it didn't work. But you want to give it a good, so this is definitely like a more extensive conversation with your doctor. But talk to them about, if you're trying something and it doesn't work, how long did you try it for? What did you do? You really wanted to get into the nitty gritty of that, because if somebody comes to me and they said, I've tried everything, it doesn't work, that doesn't help me help you, right? We want to know what you tried, how long did you give it? Do we think that's enough time? So that goes for calorie counting apps as well. That's going to do it for today. What amazing, fabulous questions you all had this week and every week. And also now in January, I'm doing the daily office hours in shorts. So if you have questions, please leave them here, leave them on another video. I'll find them. You all have such great questions, and I think they really help a lot of people out there. So if you have a question, please leave it somewhere on the channel. If you want to work with me directly, I do work with people around the world as a life coach to help them with the non-medical aspects of their weight loss as well. So if that sounds like you, if you have a lot of questions, and if you want to work on the lifestyle changes as well, I will leave all that in the info down below. Thank you so much for watching, and please be well.